Hi, welcome back to your class about ovulation with natural fertility and power. I'm Dr. Emily Pocha, naturopathic doctor and owner of Wildcraft Medicine in La Jolla. So we are about to start part 2 of our series of 4, and we're going to be talking about how to track your ovulation. So different things you can look at to see if you've ovulated and when you've ovulated in your cycle. Last class we talked about what ovulation was and what hormones are needed to play a delicate role in talking to the different parts of the body that deal with ovulation. So now we're going to dive into how we can tell from the outside if we've ovulated. And this is important because in order to get pregnant, we have to ovulate, and we also want to make sure that we have intercourse at the right time to make sure the sperm and the eggs meet at appropriate timing. Okay, so different ways that we can track ovulation. There are sticks that you can buy that are ovulation sticks, and they check when your LH surge happens. Remember, we talked about when the LH surge happens, that's when the ovum is released into the fallopian tube, creating ovulation. So you can do that. There's basal body temperature tracking, and there's cervical mucus tracking. And I think that a combination of all of these methods is really helpful when we're looking at ovulation, especially if you're having any kind of fertility issues and you want to know, are we having sex at the right time? Are we timing it right so that you can actually get pregnant? So let's talk a little bit first about basal body temperature. So basal body temperature is the lowest body temperature attained during rest. And it's best taken first thing in the morning after a good night of sleep, before moving around and before drinking any water. So you want to get your temperature, and you want to do it around the same time every day. That's really important because that basal body temperature can fluctuate. We want to make sure that we're getting an accurate reading. In particular, it's going to fluctuate most after we ovulate. When we ovulate, we have a rise in temperature after ovulation. So as you can tell, it's definitely helpful to see if we've ovulated, but it happens after we ovulate. So we also want to make sure we know when we're ovulating, because it's best to have intercourse before you actually ovulate. We have a fertile window of about a week. We want the sperm to be present in the fallopian tube before that egg is released. That way when it is released, they have more chances of meeting. So that being said, basal body temperature is really helpful for knowing that you have actually ovulated, and your temperature will actually continue to stay elevated throughout the second half of your cycle, that luteal phase, until you have your period again. So it's kind of a good way to also track how long that luteal phase is. If you continue to stay, that basal body temperature is typically elevated for about 12 to 16 days. If it's longer than that, then that's also a clue that you may be pregnant. The other way to look at basal body temperature is if you have elevation of temperature for 16, 17 days and then it drops, that's a pretty good sign that there was a miscarriage. So again, just different ways to use basal body temperature to tell a little about ovulation, fertilization, and so forth. So we want to take our basal body temperature first thing in the morning, same time every day, before moving around, before drinking water. And there are special thermometers that's important to use when we're tracking. And we'll put some links at the bottom of this video so you can have some good resources if you want to purchase them. So that's one of the options. The next option is to, and I suggest doing these all together, is to look at your cervical mucus. But cervical mucus changes throughout our cycle. So right after our periods, it's typically dry, sticky, and as we get close to ovulation, you'll get a creamy, slippery, wet, egg white type consistency. I know there's a lot of taboos about vaginal secretions, but it's really important to understand this for fertility's sake and ovulation's sake. So let's get really comfortable with our bodies and what's going on so we can understand what's going on and make sure that we are having optimal ovulation happen. So the best thing to do is to start tracking right away so you can start to learn what's happening with your body. So once your period ends is when you want to start tracking and getting a sense of what's happening with your cervical mucus. You'll notice right after your period that it will be drier, maybe sticky. And the ways to track it and look at it is when you actually go to the bathroom, you'll want to wipe always front to back. You may want to try actually wiping before you urinate and then after, and you'll notice some buildup on the tissue of some mucus, and you actually want to put it between two fingers, rub it together, and pull it apart, and you want to see, does it break, does it stay connected? You'll notice that the drier cervical mucus won't really spread apart much. It'll be kind of drier and crackly. As you get closer to ovulation, that will actually be a wetter consistency and a little bit sticky. And then right during ovulation, it'll be almost like an egg white consistency. And you'll actually be able to spread it between your fingers about an inch or more. And that's a really good indicator that you have very fertile mucus. And the reason why we have mucus that changes in our cervix area is that we want there to be a slippery highway for the sperm to get to the ovum quickly. So that's why the mucus changes. It actually also has glucose in it, which fuels the sperm. The sperm can actually stay alive for a few days in the fallopian tube, and so the cervical mucus actually helps to fuel it. So there are lots of different interesting reasons for cervical mucus. So again, the best things to do are to wipe and look at what's on the paper and feel it both before and after urination. You can check about 3 times a day. That way you can really get a sense of what it feels like and what it looks like. You also want to just ask yourself, like, throughout the day, what does your vaginal secretions feel like? Do you feel wet? Do you feel dry? Does it feel slippery? So that's before you even wipe. Sometimes you can tell just by sitting there, oh, it feels a little bit wet in my underwear. So you do want to kind of start to pay attention to that, because that will give us some clues about what's happening with your cervical mucus. The other things to remember is don't check your cervical mucus after sex, because they interfere with what the cervical mucus looks and feels like, as well as being aroused, because we'll have natural secretions that increase when there's sexual arousement, so you don't want to check cervical mucus then. The other thing you can do, if you're not sure if it's cervical mucus or just vaginal secretions, if you have it in your hands, you can actually drop it in some water, and the cervical mucus that's fertile will actually drop like a ball to the end of the water, whereas vaginal secretions, it's more water-based and will dissolve. So that's kind of a little bit of a way to tell, is it just wet vaginal secretions or is it cervical mucus? So again, you want to track this because cervical mucus changes before we ovulate. So if we know what our cervical mucus is doing, it can give us a clue that, hey, we're getting more and more fertile, we're about to ovulate. Start having intercourse then, and then you want to make sure you're continuing to track your basal body temperature to verify that you actually have ovulated. So again, once you notice that fertile mucus is indeed fertile, it's going to be egg white consistency, it's going to be slippery, it's going to be wetter. That's when you want to start having intercourse, and your fertile window is about a week. So having sex every other day for about a week is typically the suggestion. And then continue to check your basal body temperature, because it will go up and it will stay elevated throughout the second half of your cycle. So that's a little bit about tracking ovulation. You can also use the LH sticks, which you buy over the counter, which you urinate on, and they will tell you when your LH surges. Again, that happens before you ovulate, so that's another great tool that you can use before you ovulate to give you an idea of when to start having intercourse if you're trying to get pregnant. And if you're not trying to get pregnant, it's also a great way for birth control. If you have a regular cycle and you track these things on a regular basis, it's a great way to know, hey, this is my fertile window, I'm going to have protected sex, and be really cautious about not trying to get pregnant. So there's lots of ways to look at it, but for fertility purposes, this is a great thing to track so you know when the best time is, what your best chances are to get pregnant. I'm going to include a few different charts for you guys. I'll give you a link to some basal body thermometers. There's a wonderful chart you can use to track your basal body temperature, as well as the consistency of your cervical mucus and your periods. You can get a really good sense of how long is the first half of my cycle, how long is the second half of my cycle, when am I ovulating. Knowing these things is very empowering, because remember, that second half of your cycle, that luteal phase, is key if you want to become pregnant. That's when progesterone is higher, And if we don't have enough progesterone, then we have shedding of the endometrial lining. And if we don't have enough progesterone and that phase is short, even if you have a fertilized ovum, if it doesn't have long enough, and it takes about a week or so to get to the uterus to implant. So if there's not enough time there for that ovum, that fertilized ovum, to get to the uterus, and the uterus lining sheds before that happens, even though you're fertilized, you're not going to have a viable pregnancy because you don't have the nutrients and that endometrial lining to fuel the pregnancy. So having a long enough luteal phase and enough progesterone is really, really important. And this actually is a perfect segue into what we're going to be talking about during our next class. So we're going to be talking about some common issues with ovulation. One of the major ones is lack or low progesterone or lack of progesterone, shortened luteal phases. You can have issues with something called PCOS, which we'll talk about, polycystic ovarian syndrome, as well as a handful of other hormone imbalances that can influence ovulation and make it harder to get pregnant. So stay tuned. If you have any questions until then, please reach out and we'll give you lots of resources at the bottom of the video. Have a great one and we'll talk to you soon.